Hello, everybody. Thanks for joining us this evening. We're going to have a fabulous discussion this evening with two real experts on mental health and the impact that the coronavirus pandemic is having upon families across Massachusetts and across the country. But first, I just want to thank all of you for self-distancing, for protecting your family, and by doing so, protecting everybody else's family. Especially the families of our frontline workers, the doctors, the nurses, the grocery store workers, the people who are our sanitation workers still coming every single week, policemen, the firemen, all of those people working at pharmacies, grocery stores. They're just doing a phenomenal job, but putting themselves at risk for us. So we should do everything we can in order to protect them as well. And that's how we'll make it through this at the fastest possible pace. So thank you. And I want to thank my two special guests here this evening. We have Tammy Gouveia. Tammy is a state representative from Concord and Acton and Carlisle and Chelmsford. But she's also a trained social worker. She's also a public health professional. And I thank you, Tammy, for joining us. She's also on the Mental Health Committee up in the State House. And Dr. Michael Goldberg, who is Director of Child and Family Psychological Services, but he's past president of the Massachusetts Psychological Association. So I thank both of you for being here. And Tammy, let me begin with you. Can you talk a little bit about what you see as a need for a legislative response in Massachusetts to the mental health needs that have been identified as this pandemic continues?
Yeah, thank you so much, Senator, for having me here today. It's really an honor and a privilege to share this space with you again. I also want to thank you for being a role model and showing off your mask the other day out in your neighborhood. I know it's gotten a lot of traction on social media, which is very well deserved. I think it's critical that we, continue to engage in role modeling for citizens of the Commonwealth, because I still see too many people who are not engaging in physical distancing and in the ways that we might want them to. So I appreciate you being a role model and for hosting these. I think these are daily events that you're having, and really appreciate the way that you're communicating with the residents of our great state of Massachusetts. In terms of the legislative response, they're very...
Tammy, just want to say thank you so much. And I'm actually married to a public health doctor, Dr. Susan Blumenthal, MD.
Yes.
So she tells me as a public health doctor, my job is to be modeling. I have to be out there doing what it is that I'm asking other people to do. So thank you for that. And and hope everyone wears their mask when they're out on the street. So thank you, Tammy. And again, what are our needs? What should the legislature be looking at right now?
Yeah, there's a number of things that I think we could be looking at and should be looking at and already are looking at. We have very almost daily calls. Well, we definitely have daily calls on a whole host of issues, both in the Progressive Caucus, along with the Democratic Caucus, and all of the committees are meeting and conversing regularly. Just today with under the leadership of Marjorie Decker, we talked a lot about behavioral health needs as it relates to substance use, as it relates to mental health, of people who already had pre-existing mental health conditions coming into COVID, and how we could do a lot better in our state around making sure that we're addressing their needs on an ongoing basis, and also making sure that our behavioral health care folks have the PPEs that they need as they're providing care to their clients and their patients. The other area that I think is really, really critical, and I keep asking the CEOs of the local hospitals, I keep asking our frontline healthcare workers, as well as our first responders, around mental health needs. You know, we have healthcare workers who signed up as nurses, as doctors, to take care of patients and to bring people to a state of health and well-being and to save lives. And unfortunately, with the impacts of COVID-19 and coronavirus, and just how far behind we were in so many ways on testing and PPEs and just being able to keep up with the number of people who will become infected, I think we will see a number of people who, and we're already seeing it, almost 1,000 deaths in the state of Massachusetts. So really making sure that our frontline healthcare workers have the support that they need from their institutions to manage how they're handling, whether it's PTSD or grief and loss. And that's the other thing. So many of us, our whole way of interacting and being in the world has changed so dramatically in the last 4 weeks. And that comes with a whole host of mental health considerations. And so those are things that we are talking about within the legislature. I have raised these questions and concerns, as I said, to the CEOs of the local hospitals, to frontline healthcare workers and first responders, but also to the Speaker of the House to say, there's a lot more we could be doing. And also, there is a new effort underway to pay attention to domestic violence as well as it relates to this issue and to the pandemic.
So let me ask Dr. Goldberg, what is the impact of something like this on human beings? Is it different for children and adolescents and adults? Does it matter how old you are? And this whole issue of no longer having kind of person-to-person contact, but online contact being a substitute. Can you tell us what you're hearing from your patients and what recommendations you would give to people who are watching this evening?
Yes, certainly. First, I'd like to say, thank you. It's a privilege to be here with both of you, two legislators that actually have a really unique knowledge and track record in understanding and advocating for mental health in the state and in the country. So that's a privilege. And I know the representative mentioned that tweet of you the other day, and I would like you to know that you've become a folk hero amongst a group of 20-year-old Scituate High School alum who are really excited about your Nike high tops. And I'd like to figure out what particular kind you had. But
Air Jordans.
And the Air Jordans. And that might be how they're coping, but they wanted me to ask you that. So, but in all seriousness, your question's a good one. And I think the first message I'm going to have is really pretty general, that the reactions are intense, they're pervasive, but they're also very varied. And there are certainly some similarities that we see in things that are affecting people across age groups and certain populations. But one of the messages I want people to know about themselves and their relatives, people that they're working with, is that the reactions are, in a lot of ways, not necessarily predictable. Although we know certain themes, people are going to react at different times in different ways. We're certainly seeing across the age span, increased anxiety and fear and depression. When people have existing mental conditions, whether they're substance abuse, eating disorders, anxiety disorders, mood disorders, times of stress are associated with increased, exacerbation of those symptoms and those problems. And clearly, this is probably the most pervasive adverse experience in my lifetime in terms of what we're experiencing across the Commonwealth and across the country. So you not only will see different reactions from different people, but sometimes people will seem like they're reacting fine, and then another day or another time you see other reactions. So certainly there are older folks who are affected in different ways than people living with their parents or their family, and we can certainly talk about more details as the conversation goes on.
Well, what is the impact of not having face-to-face patient time mean in terms of how a patient would be reacting to the conversation or the treatment that you might be trying to recommend?
Yeah, and somewhat with your other question before, but I would say before we can talk about patients in general, in terms of social distancing, we know not just from our current experience, but we know from research and looking at situations with Ebola and SARS and other adverse events, that social distancing is associated with increased confusion, sadness, anxiety for sure. But in terms of working with patients, and the representative talked about personal protective equipment for people working on inpatient units and in residential facilities, and I have friends and colleagues that are nurses and doctors, and that's a real serious concern. In my case, I work predominantly with outpatient care, and we in our practice we've been doing telehealth since 2016. We've been training clinicians. I first did that with the Mass Psychological Association in 2016, and we've been training clinicians and providing telehealth services for years. And psychotherapy and outpatient psychiatry really, in terms of healthcare, actually do lend themselves very well to providing services over video conferencing. But to your question, it does change the dynamic, and everybody is individual. The good news is that there is actually decades of research at places like the Veterans Administration and other institutions looking at the effectiveness of psychiatric services provided by video conferencing. And in general, if we take 100 adults who come in person versus 100 adults that participate via video conferencing, the actual results and outcomes are the same, that people get better. That doesn't mean that there won't be certain people within that group that have trouble because of technology, or providing services for a 7-year-old boy with hyperactivity over video conferencing can be a challenge. So overall, the experience is good. It's someplace in healthcare that it is easier to adapt, as long as we don't have barriers from policy. In our particular practice, 100% of our providers are providing services over telehealth in our 18 offices around the Commonwealth. And
would you urge patients to take advantage of that, to not wait until they can be in the office again? Would you say do it and take this opportunity on telehealth to get the help, to get the counseling which you need?
Yeah, very important point. And it's not just my opinion, it's really based on the research. And when people are going through traumas and adverse events, being able to address feelings of being overwhelmed or intense fears or depression earlier on is associated with better outcomes. And likewise, I think you both know very well that in general, access to behavioral health services is a real weakness throughout the country. And there's a unique phenomenon going on right now where, and this is, we can talk, we've seen this in domestic violence reporting and child abuse reporting, that, because people aren't in contact with their physicians for regular well visits, and their, school guidance counselors as much as they were before, and some people are sick or unavailable, there's actually a very unique ability to access behavioral health services right now, but I don't think that's going to last very long. We're working with healthcare entities like Atrius Healthcare, and their 750,000 patients and providers, and we're really expecting, a wave of behavioral health needs in the next couple of weeks. So yes, sooner is better.
Sooner is better. And Tammy, you're like a full-time legislator with all the calls that you're getting right now, but you're also a full-time parent at home right now. So how is that helping to inform your understanding of what the needs are across the Commonwealth?
In a really big way, I'll be honest, Ed. So I have a 15-year-old, and they just started to really ramp up remote learning, which has its own sets of challenges. And then I have an 18-year-old who we were trying to keep in California where he was in school, but then it became apparent that he needed to really be back here in Massachusetts. And it's been a tremendous impact in terms of, and it's one of the reasons why I've been talking with constituents to check in on our young adults and our teenagers, because while they might seem like they're fine, there's a lot going on underneath that they're just not able to even, if they are in touch with it, they're not able to articulate it in the same way. It might come through as anger or seem like they're depressed, but they're confused. They're worried about their grandparents who might be, in their 70s, who are, not as well, health-wise, their health status-wise, or they're worried about their friends who might be homeless. My older child has friends who are staying on campus because they don't have another home to go to. And so there's all of a sudden, all of our systems that haven't been working for people for, quite honestly, probably decades, COVID-19 is making those issues, exacerbating them to an extent that we cannot keep up with, that we are not adequately prepared to really keep up with. And my hope is that after things settle down, that we can have a real conversation about what does it mean to have a fully functioning system that makes sure that people have access to food in their own home and they don't have to go to one of 1,200 feeding sites that only puts them at greater risk of exposure. So I think a lot about our folks who are in gateway cities. I grew up in Lowell. I know what it means to grow up in a dense urban environment and what the challenges are for families in trying to access the services, to access the food, to access, making sure that they can pay their rent and keep their roof over their head. And so, to think about all the layers of mental health, I'm in a very privileged place, just where I am with my family. And I even see the anxiety level in my children in ways that I can't even imagine what it's like if you have a parent who's an alcoholic or a parent who is really just so stressed out about how to make sure that they are being able to take care of that family unit in a place where there's no place to go. For so many families, they're really, the quarters are very, very tight, and there's no space in ways that we are accustomed to being able to go hang out with some friends in a public setting. We're not able to we don't have those outlets in ways that we used to have. And so it adds a tremendous layer of stress. And I'm worried about our seniors in isolation. I'm worried about my friends who live all alone, who don't have a partner or a pet or children who are, engaging them in certain ways. So I'm making sure that we're checking in on our seniors, that I'm checking in with my friends who live alone. And it goes all up and down. As you said at the outset, regardless of age, this is really impacting everybody, and it impacts people in very different ways. And we just need to keep checking on each other.
Tammy, you would recommend that everyone check in with everybody just to make sure they're okay. And then you have a human contact, huh?
Don't assume just because, right, exactly. Don't assume that just because they seem like they have everything together that they are fine, because they're probably breaking down somewhere along the way and could use that extra human touch, virtually, of course.
Thank you. So, Doctor, when I met my wife 36 years ago, she was in charge of Project Depression at the National Institutes of Mental Health, working in this agency, SAMHSA, Substance Abuse and Mental Health, SAMHSA. So, what's the risk that we might be seeing in this era where substance misuse might go on the rise? Is that something that you're concerned about right now, Doctor?
Absolutely. We were expecting that, quite frankly, and there's less imbalances, there's less connections with other people that sometimes monitor that. It's more difficult to go to meetings if you're part of a program like that. And as I said earlier, people who struggle with substances are certainly, more inclined to have those struggles under stress. And obviously with diminishing, professional and personal supports, and, seeing loved ones losing resources. And, as the representative talked about, just in terms of our high school seniors and college seniors and all sorts of people who are not able to do what they're used to doing. They're losing a sense of identity and purpose in a way that actually is associated with more difficult outcomes from trauma and adversity. So yes, there's higher risk for substance abuse and higher risk for all sorts of mental conditions. I guess the good news is I also think there are a lot of things that you guys have been doing as legislators, that we're doing in the healthcare community, that individuals can do. And one of the messages that I want to get out is kind of like you asked before, is whether you seek professional help or not, take care of yourself, take care of others. And there are a lot of resources and a lot that you can be doing. But if you, it's like how many psychologists does it take to change a light bulb? One, but only if it wants to change. So all these information we give and all these resources we provide, they're only as good as people's willingness and ability. And Representative talks about real life barriers to taking advantage of things as well.
So do you want to talk about this substance misuse issue as well, Tammy?
Yeah. Well, back to an earlier conversation you had in this segment, what I'm hearing is that for the most part, behavioral health access to telehealth is going fairly well in the state. The challenge is if you live in a rural area, and I think the doctor talked about, access, that are other barriers, but for the most part, it does seem like it's going fairly well in our state. So that really is the good news. And there are a plethora of resources that people are accessing. I think the challenge is that unfortunately, we are in the middle of both a pandemic and an opioid epidemic at the same time. And, the overdoses are still happening, sadly. One of the things that I'm really excited about is that a bill that I filed last year was passed in a budget. It gave $150,000 to the State Department of Public Health, and they have put fentanyl test strips out through the police department so that people can at least test for the presence of fentanyl, so that it's a harm reduction strategy. So while we are really focused on COVID-19 and responding to the pandemic, we aren't forgetting about the other issues that existed before the pandemic became a real focus in the news and our attention legislatively. So there are still programs that are going on. We are trying to figure out how to make sure that people have access to the ongoing supports that they had. And for folks that are constituents of mine, they're reaching out to me and saying, listen, I have an addiction problem and I'm really struggling. Can you help me? And so just, for folks who are listening, if you need to reach out to somebody you don't know where to turn to, reach out to your state rep, reach out to the senator here, and he can help get you connected to who your state rep is, because we can get you connected to the kinds of services that can really help you through this. And I'm sure the doctor also has other resources as well that we could share. But the programs are continuing. We're not saying, oh, not as much of an issue. It is. We know it is still an ongoing issue, and the pandemic makes it even more challenging for people to maintain a state of recovery and sobriety for all the reasons that we've already talked about.
Yeah, can I ask you, Doctor, no one really signed up for this. This is just an amazing situation where our frontline workers are putting their own health, their own lives at risk, and their own families' lives at risk if they bring it home. And they've never really been in a situation like this. So can you talk a little bit, if you could, Doctor, about the mental health issues that you see potentially emerging for the doctors, the nurses, the police, the fire, the grocery store workers, the electricians and plumbers who are still going into people's homes because electricity and plumbing is still breaking, and yet they're taking a risk. What are those mental health issues from your perspective, and what would you recommend that we put in place as programs or recommendations that we would give to all the people who are in that community?
Yeah, I think you're absolutely right, and this is something that's very much on my mind as I've been working in the last 72 hours a lot on expediting training and access for a resiliency program that we have statewide for frontline healthcare workers. But I spoke to somebody in leadership at Boston Medical Center Emergency Department last week, and he told me that their projections were 30 to 35% of their staff were going to contract the virus themselves.
Yeah.
And in today's Boston Globe, we saw the first death of a Boston police officer. I'm sure there are other communities around the Commonwealth. There are 60, I forget exactly, 63 or 65 active police officers in Boston alone that have tested positive. I spoke to one of my doctors last night, whose husband is a firefighter in the Commonwealth. And I've heard from them, the different fears that they have in trying to balance their commitment to the greater good in the community. But as police officers and firemen, fire personnel and healthcare workers, etc., their jobs are bringing them into contact with people who either are known to have the virus or obviously may not have the virus. So there's a lot of fear. There's a lot of ethical and moral dilemmas that they're facing, and it's nice.
Can you talk a little bit about that, Doctor? The ethical stress that some of these frontline workers are being exposed to, maybe for the first time in their lives, and what mental health problems that might help to create for them.
Yeah, I mean, even the ones that are used to it, like some of my emergency physician friends, are certainly not used to it at this level of risk and this pervasive throughout the department. And I think the representative talked a little bit about this. I mean, the lack of PPEs and insufficient PPEs is certainly, certainly unfair, but it certainly causes increased stress and anxiety. This is, we call it a novel virus. It's new. These are very intelligent people that have studied a long time and worked a long time, and they're dealing with, healthcare issues that there isn't really solid information on. It's changing every moment. They are taking care of people who's, can't have their loved ones with them when they're dying. So it's really, the moral dilemmas are just all over the place. And I'm seeing people who are, once again, having to having to struggle with their commitment to caring for others and exposing their own children and their own family. So we're seeing nurses and healthcare workers who can't, be with their children, can't be with their family. I have a neighbor who is living on his boat because his wife works in a nursing home. So they can't comfort each other. They can't be together. So there's different kinds of isolation for them where at least I can be with my wife and my children because all my clinical work is through video conferencing. I feel very, very lucky. So
may I ask, Doctor, would you recommend to people who are now in this situation and having this ethical stress that they're trying to cope with right now, maybe for the first times in their lives because they've never actually been exposed to the risk themselves, and as a result of their families, should they be seeking help, advice right now from mental health professionals to help them to work it through at this stage, because it's going to continue for some time?
Yeah, maybe, and let me explain that. There are a lot of organizations, a lot of healthcare institutions, I mean, police departments, fire departments, other organizations that I think are doing a really good job, as the representative talked about earlier, is reaching out to people, engaging with them. So what I would say is that everybody should be talking and listening. You should be, reaching out to people, not only in your neighbors and your families, people in your organizations, checking in with them on how they're coping and how they're doing. In certain organizations, are providing, check-in kind of support groups for doctors and nurses and other things. I think I'm not going to recommend that everybody who's under stress seek professional help. But what I would recommend is for those who are really having high levels of fear, of confusion, of sadness, of hopelessness, that those folks should really start by asking for help from your friends, your support system. For people that you may not be seeing, your physicians, they're still there, most of them. Call, reach out, your kids' guidance counselors. Some school districts are doing a really good job. I've seen emails from a lot of the school districts in the Commonwealth providing resources, making themselves available. And for some people, out of sight is out of mind. So if they're not walking by your office or walking into your office, they don't realize that you're there. We know intellectually about technology, but for a lot of us, it's just not used to that. But definitely for the people, if you really want to help others, make sure you take care of yourself first. Your ability to do that will be stronger. And these are really challenging times. I'm hearing it consistently from really smart, really successful physicians and nurses and, orderly, people from every level of healthcare, that it's taking its toll.
Beautiful. Thank you. And that's great advice. And I hope people who are watching take your advice, Doctor. And Tammy, let me ask you this final question. As a state representative, you are right there on the front lines. You have people talking to you all day long.
Yeah.
And do you have a story that you might want to share with us over the last couple of weeks of somebody calling in and talking to you about their issues right now and the help that they need and the help that maybe as elected officials we're going to have to put on the books to make sure that it's out there for them? Do you have a story that you'd like to share with us?
Yeah, absolutely. It's something that, and it's, well, there's two aspects to it. The first is it's primarily driven by economic structures, in addition to and the stressors that not having a source of income right now has impacted so many of our families. And I'm grateful, and I think many families are grateful for what the CARES Act has done for so many families, but there are still many families and workers that are left sort of out in the lurch, who aren't really sure what kind of support they'll get from the federal government and what kind of support they'll get from the state government. So I have been consistently hearing from people who work in the gig economy and our small business owners. And in terms of the ethical dilemmas that come up, the story I want to share is I have a friend who owns a restaurant who wants to take care of his employees. So he has figured out a way to take on a second job so he can keep paying his employees so that they still have food, income coming in. He's already working full time, figured out a way that he can get some additional income, and he's going around and driving to their houses and handing checks over to them. And I'm hearing this over and over again from our restaurants and our bars that are already struggling on their own, and they're really working hard. Sorry about the cat. They're really working hard to take care of their employees who have made them successful. So I think part of the story is the human story of coming together. We know we're all in this together. But it goes back to, we have a lot to figure out with the economy, and how to get people, really making sure that they're able to cover their expenses. And I think our frontline healthcare workers, while they're taking care of people, while our first responders are taking care of the public health and public safety needs of our communities, they're also contending with what's happening at the national level and what has and hasn't been done and how that's filtering down. So I think the stresses are very myriad. They're very local and they're very distal. And I think that's important for us to not also lose sight of in the midst of this. But the story I share has to do with, it gives a little bit of hope that people are really working together, when, we have someone in the White House who's not really working hard enough for us in so many ways. But that causes its own stressors as well.
No, and Tammy, that's a dilemma that we have right now, because we passed this big bill, $2.2 trillion, and the money for small business is not completely exhausted, but it's going down quickly because so many people need help. But we also put in 130 billion for hospitals and medical care. We also put in money to try to help the states and the local communities who are also providing services as well. So Mitch McConnell sent us a new bill last week saying, well, let's just take care of the small businesses. And we want to take care of the small businesses, but we want to put in tens of millions, hundreds of millions of extra dollars for the cities and towns and hospitals and the whole medical system as well, which are the frontline people. So we're holding, saying, no, if we're going to do small business, they're critical. We want to help them, but we have to do, what we have to do for the frontline responders. And those are that's the medical community, and it's the people who are working in the cities and towns, because the communities are hemorrhaging money, and we don't want them laying off teachers or nurses or police or fire. We need them in the front line here, and we have to provide the money from the federal government in order to help them. So we're going to hold, and we're going to get that done too. We're not going to relent. We want to make sure.
Well, thank you for holding. Yeah.
Thank you. We want to make sure the whole system's in place. Thank you, Tammy. So let me finish with you, Doctor.
Yeah, thank you.
Thank you, Tim. If you have one final piece of advice to anyone who's watching this tonight, Doctor, what is your recommendation to them?
Yeah, I would like to end on a positive note, to be frank, and I think we need a little bit more of that. We all know that this is an unprecedented and intense stress that's affecting so many people in so many very serious ways. But I also think a part of coping with this is it is creating some new opportunities for people. And we talked earlier about kind of losing your identity. And I hope that people can get a time and get past the immediate stresses, whether that's fear of your own health or losing a graduation or a senior year. And they could get to a point where they can make the best out of this. Building on Tammy's story earlier, I spoke to a friend from high school this morning who's been a waiter for over 30 years. And he's devastated. He's got a family. I mean, it's been a nice restaurant. He did well, college educated. And he's like, I don't know what I'm going to do. And what I said to him was, Tim, I said, you are a smart person. You're college educated. You have great people skills. Hopefully this will end soon. You'll have the opportunity to go back to work. But, maybe we'll look back and this will be an opportunity where you took advantage and made something of the situation. I see people, myself, I've taken advantage of exercising more. My 20-year-old being quarantined with me has pushed me. I'm learning better physical health skills. And some people are reading more. We're seeing, there are also healthcare workers that can't do their profession. People like dentists and my friends, an oral surgeon. But there are opportunities to advance your continuing education. And I realize that people who can't feed themselves or are in immediate danger or fear, I realize that they're not there. But there are a lot of opportunities, whether it be a new business plan or a new business venture. We're all going to get out of this at some point. And with you two and your colleagues on Beacon Hill and in Capitol Hill, hopefully we'll get out of it better than we would otherwise.
Thank you, Doctor. And thank you for that optimistic note. We're all in this together. It's one big family. We can see that more clearly than ever before. We're all interconnected. And I think, as Tammy was saying, we all want to help each other too. And out of this, there can be a lot of positive experiences for people that they're going to look back at and say, that I appreciate the things that I learned during this time. So I thank you, Dr. Michael Goldberg. Thank you for being with us this evening. And thank you for being kind of willing to be a part of your professional association, the past president of the Psychological Association of Massachusetts. And to Tammy, thank you so much for the leadership you're providing up in the State House right now to make sure that we put the right policies in place for all the families of the Commonwealth. And we're not just the Bay State, we're the brain state. So we should set the model for mental health and substance abuse issues for the rest of the country, for the years ahead, and the lessons we're learning right now. Thank you, Tammy, for your great leadership. Thank you, Doctor, and thank everybody for tuning in this evening. Stay safe, stay distant. We'll make it through together. Thank you all very much.
Thanks.
Thank you.